Okay, so Dr. Bruno here, and I wanted to talk a little bit about bone density. If you're an older woman or older man, you might be sent by your primary care doctor for a bone density test to determine if you have a risk for osteoporosis. Um, Bone density test is usually done with a nuclear medicine type scan. And they check your bones, and basically they're checking for the presence of calcium in the bones. When that level is below a certain level, they call it osteopenia. If it's much lower than that, bone density much lower than that, they call it osteoporosis, basically. Um, the difference between osteopenia and osteopenia is the loss of bone calcium. Osteoporosis is actual damage to the bone by such severe loss that the bone now is brittle. Bone density increases with weight-bearing exercise, so that, in other words, people who go for walks every day are going to have stronger bone density than somebody who sits at a desk all day. Likewise, because it's weight-bearing, if somebody has a job where they're doing heavy lifting every day, they're going to have strong bone density, again, as opposed to somebody who lifts nothing and sits all day. So people with active jobs are going to have higher bone density. People who exercise are going to have a higher bone density. Bones are basically stimulated by stress, and gravity is one of the stresses. But any of the exercises that people do, let's say swimming, playing tennis, even golf, will stress the bones and make them grow more, so that the bone density will be higher. These are basically also the treatments for patients who have low bone density. Now, if you already have a problem, this has to be treated with a couple of things. One is vitamin D. Vitamin D helps the bones to absorb calcium. And since it's absorption of calcium, you need also a calcium source. People who have low calcium in their diet also typically have problems with bone density issues. When I have a patient who has just kind of a borderline problem, I'll tell them to take 1,500 to 2,000 milligrams of calcium per day, and then also take a vitamin D source, again, of about 2,000 units of vitamin D per day. When bone density problems are more severe and you have osteoporosis, then we have to use medications that help to push the calcium into the bones. You'll see these things mentioned on TV. They're either pills or injections. In some cases, they have injections that can be once every 3 months or once a year, and improve the bone density the rest of the year. This is a little bit on that. And by the way, one way that you can be concerned about bone density issues is if you notice you start having teeth issues. People who have teeth that break easily usually are having problems with bone density, because the same thing that causes dense bones also causes density in the teeth. And if the teeth are becoming brittle and cracking a lot, you probably also have problems with the bone density in your bones too. Okay, take care.